Saturday's protest drew hundreds of people, some in masks, some not.
There was basically no social distancing. So how much of a health risk are these protests put on participants? Our senior health correspondent Monica Robbins explains.
Many protesters wore masks, but some removed them, didn't wear them correctly, or didn't wear one at all. And health experts fear mass gatherings like these are a recipe for infection.
Although I appreciate their right to protest and demonstrate, it really is creating, I think, a situation which is a perfect storm.
Hospitals now bracing for a potential surge in cases. Doctors hope participants monitor their health, seek treatment or testing if needed, and remember symptoms expanded.
It's generally fever and non-productive cough. Shortness of breath, if that develops, is particularly worrisome because that portends a worse course and more complications later. GI manifestations, including nausea, vomiting, diarrhea, can be a part of this. Also, the fact that you can lose your sense of smell or taste.
The other concern is that COVID-19 is taking a higher toll on communities of color. According to the COVID Tracking Project, states reporting race show African Americans are twice as likely to die from COVID-19. Cleveland has also seen a spike in cases.
We've had an uptick in cases surrounding University Circle. Plus, we know that these folks generally have less access to medical care. They have many other comorbid states, meaning other medical conditions that place them at risk.
Dr. Salata encourages those who participate in protests to do so peacefully, stay 6 feet apart, wear a mask, and carry and use hand sanitizer. Otherwise, the pandemic may interfere with the message. Monica Robbins, 3 News.